now we are entering a period where we need more outcomes, and also we need more strategies to analyze those outcomes. And why we need more outcomes? Because our knowledge of the disease is increasing. So we need to improve our treatment targets, and we need to be able to capture subtle treatment effects or very specific treatment effects that can only be captured with very specific measures. So, for example, imagine you have a drug that targets a very specific path in the pathogenesis of the disease. You need an outcome measure able to assess this path. Otherwise, you will probably miss the treatment effect. And this treatment effect can be subtle if you observe that in the context of the whole disease, but very crucial because it is exactly the path that is being tackled by the drug. So this is one thing. So we need better clinical outcome measures. The other thing is that we need more analysis strategies to be able to handle this new wave of new outcomes that are being created. So there are two different needs here. And my talk was mainly based or focused on understanding which are the analytical strategies that we need to kind of create, because they haven't been created yet, to be able to handle this large amount of outcomes. At the moment, most of the clinical trials that are being carried out use one strategy. The first one that I exposed, which is I called it conventional, but these are univariate models. So you have one variable, which is your outcome measure, and you usually use only one. And you have one predictor, which is treatment. And for that, you need to know the distribution of the outcome measure. And this is relatively simple in the sense that these distributions are known. And this is what is being done so far and has been published in, I think, 99% of the clinical trials. Another strategy would be to combine different outcome measures. And this, although seems quite obvious, and we do this all the time in clinical practice, for clinical trials it's not that obvious, because the distributions of these combinations are not that clear. And also because there are many ways to combine these outcomes. So this would be kind of the second step. And then things become more complex. Then the third step, and I think this would be kind of the third step we should aim for, is the multivariate models. And in a way is combining outcome measures, because you try to predict different outcome measures at the same time. But instead of creating one outcome measure, like a combination, like a linear combination, for example, you allow for these distributions of the outcome measures to be observed at the same time. And this is very attractive, because the models that you can build to predict these different outcome measures, I think in my presentation I put only two for the sake of simplicity, but you can predict many outcome measures that are behaving at the same time and are being observed at the same time. So the beauty of that is that the models that predict those outcome measures, like in a multidimensional way, first reduce the error derived from measurement. So in a way, you get rid of measurement error more easily. This is one thing. And the other, I think, attractive point here is that you can create those kind of domains, or also called latent variables, which are not observed but are assumed And a good example for that would be, imagine you have different outcome measures that are linked to cognitive function, for example. Yeah. And you try to predict all these outcome measures that are related to cognitive function. And then you build this model. You can create a kind of multidimensional domain that is called cognitive or cognitive function or cognition. And you are not predicting anymore one outcome measure. You are predicting this big sphere or domain of which is more conceptual, which is more linked to what is probably happening in the brain. So we are not only focusing on one, but on many of them, and you get a picture of what's going on. And then, if you are able to tell if a drug is effective or not, and you have these outcome measures as this combined, this multidimensional outcome measure as the outcome measure, that can be very, very powerful. The steps that we need to take to create these multivariate models as one of these steps in the scale of possible strategies. First is to know how these individual outcome measures behave together. So to characterize very well these multivariate distributions. That would be the very, very first step.